Assalamu alaikum. Today we will be talking about the setting of teeth, upper and lower teeth, using acrylic teeth for our case. So you have finished the step where you have mounted the upper and lower casts. While mounting, we made sure that the midlines all are in line. We check that by looking at the articulator with the pen. We compare the midlines with the pen, so we can find that they are aligned. And once these midlines are aligned, and as you see here, if we remove the pen, inside the pen you can see that the midlines are aligned together. We make sure that these lines are all aligned together. The casts are aligned in the mounting, and this is when we are ready to do the setting. We make sure before doing the setting that the pen is touching the table, the screw is secured, and we will present you with the teeth. The teeth are an acrylic mold of teeth. These are a fixed size for all students, and we will be using them for setting the case we have today. So the first step, we draw the midlines and accentuate them, and then we want you to emphasize the arch of the wax. So if we remove the upper, we take out the upper and look at the wax here, you can find that the wax has an arch that is like a U shape. We want to keep the setting of the teeth within this arch. So we can use a pen. Can use this pen and just to draw a line, make sure that the wax arch is clear for you. So we want to make sure that the midlines are clear, so we have a clear midline. It's better to draw it using an ink marker for you to see it, because we want the teeth on the midline. And then we open and we begin drawing on the wax itself. So the wax corner, we just draw this line because we don't want the teeth out of this arch. And just to help you, on a glass slab, the one you will be using for the setting, we take out the upper base plate. We ask you please to put your base plate, your wax on the base plate, and using the pen, draw around it an arch. So we want to make sure that we are always comparing with this arch around. We're going to do this side of the case of the wax, and you will be doing both sides in your laboratory training. Okay, so we have an arch now, and we're ready to set the teeth. The teeth we are using today are made of acrylic resin. It is similar to the heat cure acrylic we use in dentures, but these are made by the manufacturer. So they use acrylic that is produced under heavy pressure and high temperatures. So they have more cross-linking than the denture material we will have later on the denture base. So they come in sets. These sets have numbers according to the numbers, and they have different forms and different shapes. You will take those later on in a lecture called Selection of Teeth. But what we want to emphasize here, and it's very important for setting, that the teeth sets come in a morphology similar to what you have taken in the dental morphology course, and we are emphasizing here identification of the teeth in terms of left and right of the patient. Okay, so when you set teeth, make sure that you identify which is the mesial side of the tooth and which is the distal. So not to mix up teeth while setting, for example, putting the laterals instead of each other, we will not have the ideal morphology of the arch if we have switch between left and right. We must make sure that we are identifying mesial and distal surfaces of teeth when we are setting. Also, this applies to the canines. We have slopes of canines. The distal is more rounded and longer than the mesial slope, so we need to identify them. This also applies to the molar teeth, When the molars, we still have more confusion sometimes when we are looking at the premolars because they look very much alike. For the molars, we have distinct occlusal morphology for the 6 and 7 in the upper and the lower. We can easily identify them simply, for example, that the upper is 4 cusps and the lower can have the 5th cusp here. And the cross section, this is it has a bit an oblique occlusal morphology, while this has more like a rectangle. But in the premolars, we need to identify and see the teeth and look at the teeth carefully before we begin setting them to make sure that we identify the left from the right when we're doing them. The sets of teeth come with a midline, and the teeth are divided equally, and this is where this is my right, but the patient's left. This set of teeth begins, and this is the line dividing this set of teeth. So make sure you identify the morphology and left from right before setting the teeth. So now we're going to begin with the setting. We are going to use a wax knife for this purpose. We're going to take out the base plate from the cast, and we might do a window. What are we doing now? We are making space for the tooth that we're going to place. We're going to use a hot wax knife. We're going to do like a window. So if we look closely at this, okay, we are freeing a box for the first tooth to place. So this is an empty box. After removing this empty space, we are placing the central incisor in the soft wax that we have made soft. We're going to make sure that we are on the same side. We place our central incisor and make sure that the incisal edge of this tooth the incisal edge of this tooth is with the what we call our reference. Our reference is a glass slab or a plastic in our case. So the tooth that we have placed is exactly on the same incisal edge of the wax rib. So we also make sure that the incisal edge of this tooth, in comparison with the arc that we had, which is this arch, it's also fitting. So we were checking it that it's still inside the arch. Once we are finished with this, we simply begin melting wax around the tooth to fix it in place. Making sure that the tooth is in position. It's in the arch form. It's corresponding with the midline. It's on the midline. And the arch of the tooth is going with the arch rotation. We have an overjet. You can see the overjet with the lower. And we're going to fix it in place. So we use a hot instrument, melting wax around the tooth, and we begin freeing more space for the lateral. The position of each tooth in the arch is present in the sheet you have in front of you, and we're going to follow the same rules. So for the lateral position is tilted with an arch. We put it not on the incisal edge of the central, we keep it higher by 1 millimeter. So now it's on the incisal table. We don't want it on the incisal table. We will raise it by 1 millimeter. So we're going to press it into place a bit more. So it will be raised by 1 millimeter from the glass slab. We make sure it's higher than the central. We also make sure that the neck is depressed in the wax. Its neck is depressed in the wax more than the central as well. And it's following the same arch. We are still on the same arch. And then we begin fixing the tooth into location. Once we finalize its position, we begin fixing it. If you want more wax, we can bring from an outside source. And molten wax is spread around the teeth. We put it back and make sure we're still on the same arch. We have the overjet clear from the lower as it was in the first time. And it's in correct location, and now we're going to go for the canine. Once more, opening another box. Now for the canine, it's a cornerstone in the arch morphology. So the canine position is on the turn between the incisal part or incisal section and posterior teeth, which is the posterior junction of it. So it's on the junction between two planes. And the morphology of the canine itself, it has two planes. It has a mesial plane and a distal plane. The mesial plane continues with the lateral, as you could see. But suddenly, from the midpoint of the tooth, it turns to a distal half, and the distal half is rotated to meet with the posterior arch. The position from the wax rim, the canine should be exactly on the occlusal plane that we had originally. So still the canine is still on the same occlusal plane. The mesial half of the canine is with the incisors. The distal half is rotated to the inside, so it will meet with the posterior teeth. The long axis of the tooth is upright. You have these features clearly written in the sheet in front of you. And then we fix the canine into position. Okay, so the overjet, if we look from the inside, the overjet continues around, equal between the all upper teeth with the wax rim.